Media Project Bipolar Woman, Group 11, for Dr. Emerson's class in Population Health Perspectives by Christy Bennett, Sam Dean, Allison Yannock, Sarah King, and Laura Sanchez. So first, what is the bipolar disorder? Bipolar disorder can be broken down into two different types, type 1 and type 2. Type 1 is characterized by mood elevation in a severe and persistent perspective called mania, in which there are mild or severe depressive episodes intercepted with periods of normality and well-characterized manic phases. Type 2 is characterized by mild elevation of mood, described by hypomania, which requires one or more major depressive episodes and at least one hypomaniac episode during the course of life. So this continued is bipolar disorder is increasing conceptualized as a neurodevelopmental disorder that shows its first clinical manifestations years prior to the onset. So the depressive signs and symptoms include sadness, hopelessness, lethargy, excessive sleep, fatigue, lack of interest in pleasurable activities, suicidal thoughts or delusions, and hallucinations can be present. Some hormonal changes in women can affect the severity of these symptoms and often has a later age of onset in women than men, with women experiencing a higher level of depression than mania. Depressive episodes, particularly as a first episode, are more predominant in women than men, and women are more likely than men to experience rapid cycling and mixed episodes. Premenstrual syndrome can worsen this in some women. Some treatments of bipolar disorder in women can include psychotropic medications such as lithium, anticonvulsants, antipsychotics, and antidepressants. Anticonvulsants also act as mood stabilizers and are frequently used. The reason we're kind of circling around women is because that's mainly what our media presentation is about and our case study. So I found some researchers in evidence-based practice of bipolar disorder, and they are actually in the Journal of Psychiatric Research. So in April of 2020, the Journal of Psychiatric Research published a study done by over 100 general psychiatrists throughout the United States over characteristics of youth at high risk for bipolar disorder compared to youth with bipolar 1 or 2 disorder. So in this study, clinical and psychosocial characteristics of youth at familial and clinical high risk for bipolar disorder were examined and compared to characteristics of those of youth with bipolar 1 or 2. So they were comparing the two and seeing the results that they would get. The findings are explained in a series of two tables. If you go on this website, after paragraph 13, there are two tables that describe this whole thing in so much detail, and it's so awesome. So you should give it a look for sure.
When doing research to find certain mental health facilities to treat this woman with bipolar disorder, we came across ones in Tarrant County. There was one in particular called the Mental Health, Addiction, and Developmental Services that has many across the area of Tarrant County, but the one we are focusing on is at the Penn Square Clinic, located at 300 Pennsylvania Avenue in Fort Worth, Texas. This clinic in particular treats outpatients. So this lady who is struggling with staying on her medication regimen and is often asked to leave her house from her mom, this would be an option that would be viable for her. She has the ability to go seek for her diagnoses that she has already received. In the event that she didn't know she was suffering from mental health disorder, a bipolar disorder, she would be able to go in and receive a diagnosis at this clinic. For her in particular, she would be able to go in and have mental support. She would be able to go to support groups, have her medications adjusted, and have help with supportive housing if at home is too hard for her to stay. Even if she does not have insurance, which she doesn't because she does not have a job, she would have the ability to pay what she can as she goes, and many of the costs are covered. The mission of the MRMH is that they bring recovery to people across all lifespans. They encourage success as a positive outcome for each person. They do individualized care for each of their patients. They try to practice safe, ethical, and cost-effective services, so they do not deny service to someone if they are not able to pay, which is a great resource for her as a patient who's had this diagnosis for 8 years and is unable to keep up with her medications. And they also offer many different resources for anybody, not just her in particular, if you're ever in the Tarrant County area and need to go through such a process. If a patient were new, they would go through this type of process. They would find their local MHMR area, and they would go in and schedule an appointment. If they do have insurance, they would need to bring their insurance card as well as their ID to make an appointment. After they've come in, they will have paperwork they can fill out beforehand or at the hospital or the outpatient clinic, where they would be able to discuss with the physician what they treatment are needing. If they need to receive a diagnosis or talk with the physician about their symptoms, they're able to do that. After they fill out their paperwork, have their physical done, they begin their treatment based on their needs. So it could range anywhere from inpatient to outpatient, seeing someone once a week or just doing group therapy whenever they need to.
Resource is known as the Institute for Advanced Psychiatry. It is run by Dr. Diana Gebler, who is a psychiatrist and TMS specialist that is located in Fort Worth, Texas and Granbury, Texas. She treats patients of all ages with bipolar disorder, and she offers them several different forms of treatment. She may recommend prescription medication, psychotherapy, or even a combination of both. And then, if your symptoms still aren't responding to that form of treatment, she can also recommend something called transcranial magnetic stimulation therapy, which is an FDA-cleared treatment for major depressive disorders. Basically, what happens in this is they hook up a magnetic pulse and it transmits to your brain. It doesn't require anesthesia, and most patients take it pretty well and actually see results from it, which you may think this is such a weird form of treatment, but it actually helps. This is all exceptionally helpful, especially for bipolar disorder. This disorder affects 2.8% of Americans, so it's pretty rare, but basically you just have a series of ups and downs. You may go through a manic phase, which you feel on top of the world, like you can do everything, and then suddenly go down to a depressive stage, and just these ups and downs can be very hard on patients and their families. In our example, I'm sure the mother has a much difficult time controlling her child, and just it makes the relationship rough. So going to a doctor that can offer help and support is definitely something that will help her. There are several different types of bipolar disorder that I would like to touch on here, just so we can get a broad idea of what the daughter is going through. Type 1 bipolar disorder is full-blown manic symptoms that last for a week, and then depressive episodes may follow or precede the manic episode, whereas type 2 is slightly less manic episodes. They're not as severe, but you still have that depressive phase that follows. Then there's also a third type called cyclothermic disorders, which involves multiple periods of hypomanic and depressive symptoms, and they can last 1 or 2 years, so it's more of a phase rather than just going through this for your whole life. So the girl in our example seems to have been battling bipolar disorder. We're not exactly sure what type, but all types are something that greatly impact the patient and the family because they can't ever get a consistent mood. I also put some pictures on here kind of showing the symptoms that she could possibly be going through. Some of them, as you can see here, are just an elevated mood during this manic phase, rapid speech, poor judgment, not even sleeping, honestly, just going crazy, doing whatever they want. And then this depressive phase is the total opposite. They just kind of get this negative outlook on life. They lose their appetite. They have fatigue, a loss of energy. They may even be suicidal. So as you can see here, we have our resource forms. Specifically, the resource form concerning the Institute for Advanced Psychiatry, you can see the cost. Therapy is not cheap, but I feel like it is definitely something that will help this girl. Like I said, bipolar disorder, it's such a rare thing. I think it takes a certain type of person that has the background and knowledge to know how to deal with this, to truly treat her as much as she needs to be treated. Once again, there will be a positive impact on the population, including the family. They will just actually get the treatment they deserve. There will also be a positive treatment on the healthcare environment in general. These people in their depressive episodes, you don't know exactly what they're going to do, where their mind's at. So honestly, you could be worried about them hurting themselves, hurting others, and this is taking away from treatment of other patients who probably have conditions just as bad, but aren't thinking about hurting themselves. By having someone that can specifically handle these types of people that do want to hurt themselves, you can save time for the people who are not, and everyone is getting fair treatment, and the healthcare environment is benefiting as a whole.
And listed on this slide is also the resource form for the MHMR. If any details need to be evaluated, you can always contact one of the 5 of us. And finally, we have all of our resources